As always, we like to start our calls with a message from our Hospital Executive Director, Christine Kleckser. Welcome, Christine.
Thanks, Jim, and thank you to those of you all joining us today. I want to start by answering the question that many of you have. Is anything regarding your VA healthcare going to be impacted by past and future executive orders coming from the new administration? As I mentioned at the end of last year in our teletown hall, we often see changes with any new administration. That is to be expected. We don't have answers to all of the questions you may have, but here is what I do know. As you may have seen in the media, our national VA submitted a reduction in force and reorganization plan last week in response to a recent executive order. We are not aware of what was submitted. It is required that VA publishes this plan in June of 2025, so we anticipate further guidance as that date gets closer. VA Secretary Doug Collins has shared publicly his desire to reduce VA employment levels nationally to what it was in 2019. VA currently has approximately 470,000 employees compared to roughly 398,000 in 2019. Again, we are not aware of how or if the submitted plan by our national office will affect us locally. It is important for us not to speculate on hypothetical or potential scenarios involving future VA changes. Caring for our veterans is the highest honor, privilege, and sacred duty, and we strive every day to deliver the finest possible care to our nation's heroes. With that said, we continue to have many amazing accomplishments, resources, and services, some of which you'll hear about today. We are excited to share that our next inductee into our Hall of Heroes is U.S. Army Private First Class Dennis Stoppelworth, who lost his life while serving in Vietnam. The induction ceremony with his family will be Friday, May 23rd at 11 o'clock a.m., so we hope you'll plan to join us. I very much appreciate your service, and I look forward to talking with you at some of our upcoming events.
Thanks, Christine. As you mentioned, there are a lot of great resources available to veterans. In fact, so many that it can be overwhelming to keep up with. One such lesser-known resource available to all veterans for free is the Annie for Veterans app, spelled just like the Broadway play Annie. You can access it online or on a smartphone, and it's free. Here to tell us more is Stephanie Schilling.
Thanks, Jim. VA has an automated messaging program that can help you better manage your health. Annie is a VA text messaging service that empowers veterans to take an active role in their health care. You can register and subscribe to topics based on your areas of interest to receive automated text messages with self-care reminders, tips for reducing stress, instructions to prepare for your healthcare appointments, and more. A few self-subscribe topics include blood pressure, heart rate tracking, pain self-management support, sleeping difficulties, tinnitus tips, diabetes, foot care reminders, weight management support, tobacco cessation support, and more. The primary benefit of Annie is the ability to receive different types of self-care reminders to improve your health. While Annie is primarily a text messaging service, you can also access features with the online version. Annie helps you take care of your health, one text at a time. To learn more about various Annie apps, you can self-subscribe to go to the website, mobile.va.gov/Annie. Again, that is mobile.va.gov/ANNIE. If you have any issues at all setting this up, you can reach out to the help desk at 866-651-3180. Again, 866-651-3180.
Thanks, Stephanie. That's a great free resource for our veterans. And speaking of free, great resources for veterans, we're going to turn it over to Sarah Rogers to tell us more about health coaches.
Good afternoon. I'm Sarah Rogers, the Whole Health System Coordinator at the Madison VA Hospital and Clinics, and I'm thrilled to share some information about health and wellness coaching with you. Whole Health is VA's unique approach to care designed to support and partner with veterans like you in living your healthiest, fullest life. Health and wellness coaches play a vital role in this system, and I'm here to tell you how they can make a difference in your life. Health and wellness coaching is all about helping you become happier and healthier. A health coach will work with you to explore what matters most in your life and help you create a vision of your healthiest future self. You might want to work on reducing sugary drinks, take more walks with a friend, or get back to the gym. Whatever your goals, our coaches are here to support you. Our health coaches are trained to actively listen and partner with you to make positive changes. They won't diagnose or treat any conditions, and they won't give you advice or tell you what to do. Instead, they'll support you in sustaining lasting change, focusing on areas like eating well, being more active, managing stress, and spending more time doing things that bring meaning and joy into your life. If you're motivated to embrace change and try something new on your journey to a healthier future, consider health coaching as a powerful tool. It's free and available to all veterans at the Madison VA. To get started, call us at 608-256-1901, extension 12537, and ask to connect with a health and wellness coach. Once again, that number is 608-256-1901, extension 12537. We look forward to being part of your team on your wellness journey.
Awesome. Thanks, Sarah, for that information. We hear a lot of amazing things from our veterans who participate in our whole health resources, and we hope that you join the group if you haven't already. Switching gears now to research. We have a clinical trial that some of you may be eligible to participate in. Here to tell us more, again, is Stephanie Schilling.
Thanks, Jim. Today I'll be providing information about our Gulf War illness clinical trial. This is a Department of Veterans Affairs funded research study designed to determine if taking a resistant potato starch fiber powder can help reduce symptoms associated with Gulf War illness. We will measure and compare the bacteria in the guts of those taking the fiber powder and those who aren't taking the fiber powder, and maintain their normal diet. The results of this study will help scientists develop new treatments for Gulf War illness and understand more about what causes Gulf War illness symptoms. You are eligible for this study if you are a veteran aged 52 to 88, diagnosed with Gulf War illness, and had been deployed to the Persian Gulf, Operation Desert Shield, or Operation Desert Storm during the first Gulf War from 1990 to 1991. The study will last a total of 6 months, but you would only take the fiber powder for 4 weeks. In addition, you would be collecting and mailing stool samples and complete survey questions about your symptoms. After verifying your age and deployment history, we will ask questions about your current and past health history and symptoms to determine whether you can participate in our research study. Those that end up participating in the study will receive up to $300 for providing all samples over the study period. Study participation is voluntary, and your decision to participate or decline participation does not affect your current or future health care. If you have any further questions about taking part in this study, you can contact us at 608-213-4076 or email VHAMADRESEARCHTEAM@va.gov. That number again is 608-213-4075. The email again, VHAMADResearchTeam@va.gov.
Excellent. Thank you. Our final presentation is Relationship Health and Safety when Encountering Online Relationships. Although this information is good to keep in mind for anyone who communicates with others online, no matter the type of relationship. Here to tell us more is our Intimate Partner Violence Assistance Program.
Hi, I'm Christine Way, Intimate Partner Violence Assistance Program Coordinator. Thank you for the time today to talk about relationship health and safety when encountering online relationships. Online dating began in the early 2000s and has become popular with millions of users. While online dating can be an opportunity for developing positive connections with others, there is also the potential for serious harm, resulting from intimate partner violence, extortion, and scams. When engaging in online dating and relationships, having awareness of the following safety tips for practicing safe online connections, red flags on what to look out for, and what to do if you suspect something unsafe can help reduce that risk. Key points to remember for online dating safety: protect your personal data. Don't share sensitive information like your full name, address, workplace, or financial details on your profile or in early conversations. Limit what you share online. Scammers can use details shared on social media and dating sites to better understand and target you to form a connection and take advantage of what is going on in your life. In addition, requests for inappropriate photos or financial information could later be used to extort you. Use reputable platforms. Stick to well-known dating sites with robust security measures and verification processes. Use different photos for your dating profile. It is easy to do a reverse image search with Google. If your dating profile has a photo that also shows up on your Instagram or Facebook account, it will be easier for someone to find you on social media. Verify profiles. Perform reverse image search on profile pictures to check for authenticity and potential catfishing. Be cautious with communication. Don't rush into deep conversations or emotional commitments too quickly. Video calls. Before meeting in person, try to have a video call to confirm the person's identity and appearance. Meet in public. Always meet in a busy public place for the first time. Tell a trusted person. Share your plans and location with a friend or family member when meeting someone new. Red flags to watch out for. Exaggerated stories or inconsistent information. Be wary of profiles that seem too perfect or have inconsistencies in the background story. For example, claims to live in the U.S. but are working overseas. Pressure to move off platform. If someone wants to quickly switch communication to text, email, or another platform outside the online site, be cautious. Making financial requests. Never send money to someone you've met online, especially if they ask for financial assistance for an emergency or personal situation. Avoiding in-person meetings. If someone consistently avoids meeting up in person or comes up with an excuse not to video call, it could be a scam. Love bombing or excessive affection. Be wary of someone who expresses intense feelings very quickly. What to do if you suspect a scam or that you're unsafe. Block the person. Immediately block the user on the dating site, social media accounts, or any other communication channels. Report the profile. Most dating profiles and social media sites have a reporting feature to alert them about suspicious activity. Consider contacting authorities. If you believe you've been a victim of a scam, contact local law enforcement or the appropriate consumer protection agency. If you are concerned about your safety from an intimate partner relationship, please contact the Intimate Partner Violence Assistance Program at 608-280-7085. For immediate assistance at any time, please contact the National Domestic Violence Hotline at 1-800-799-7233. Those numbers again, contact the Intimate Partner Violence Assistance Program at 608-280-7085. For immediate assistance at any time, contact the National Domestic Violence Hotline at 1-800-799-7233.
Thank you for that information. And again, this information is helpful to keep in mind no matter who you're communicating with or why you're communicating with them. So please keep those in mind. Before we move on to our Q&A, just a few reminders of upcoming events to be sure to mark your calendar. As our Executive Director, Christine, mentioned earlier, we have our next Hall of Heroes induction on Friday, May 23rd at 11 a.m. here at the hospital auditorium. Again, that's Friday, May 23rd. That's the Hall of Heroes induction. And then, as we mentioned in the announcements, as we were getting callers online, our VA night at the Duck Pond for Madison Mallards baseball game is Friday, July 25th. Again, Friday, July 25th. More information will be forthcoming, but veterans are able to get discounted tickets for that event, so be on the lookout for that information as we get closer to that date. Now it's time to move into the question and answers portion of our call. We have several questions in our queue, and we'll call your name when we are ready for your question. We can see your questions on our screen, but we'll ask you to repeat it so others can hear it, and then we will respond. Please avoid disclosing personal health information. We want to make sure we protect all veterans' privacy, as we just heard about, as we answer your questions. So our first caller is going to be Robert in Middleton. Robert, go ahead with your call, or with your question, I'm sorry.
Okay, first of all, I'm in Milton, M-I-L-T-O-N, Wisconsin. And my question is the GeroFit program in jeopardy?
Hi, Robert. This is Sarah Rogers. I spoke before. I'm the Whole Health System Coordinator. The GeroFit program is going strong. Are you a member of GeroFit, I might imagine?
Yes, I am.
Yeah. So as you know, a robust community and classes 5 days a week, often more than once a day. They're taking referrals, and in my work as a health coach, I've seen that program be truly life-changing for many of the veterans I work with who are 55 and older. So I would encourage anybody on this call who's 55 or older and interested in the GeroFit program, you start by talking to your primary care provider, and they can get you screened and referred. And thank you for being an advocate for GeroFit, Robert. I know it's a passionate community.
Okay, well, thank you. It's a wonderful program.
Agreed.
They have quite the fan club. All right, our next question is from Ernest in Madison. Ernest in Madison, go ahead with your question.
Hi, my name is Ernest. I've been going to the hospital in Madison for over 40 years, and I have to say it's a 5-star place for me. Perfect service here. One question I have is that how you handle appointments. I have an appointment the other day for 7:45, and it took me over an hour and a half before I got in. The appointments, is it first come, first served, or do the appointments run by, do they take them in by the appointment time? In other words, no matter what time you come in or check in, whatever your appointment time is, that's what you would take. So is it first come, first served, or is it by the appointment time?
Hi, Ernest. My name is Rochelle Carlson. I'm the chief of our primary care service. And thank you for your question. I'm sorry that you had to wait for your appointment. Usually, if you do have an appointment at 7:45, you would be called in shortly after that to be checked in. And occasionally, if the clinic is having some type of staff outage and they have to rearrange who might be able to see you, that may have caused a delay. I do know from my own experience as a provider that sometimes my patients may come, a half an hour before their appointment, and in that case, they may wait until their actual appointment time to be seen, because we do go by the appointment time.
Well, the 7:45 is usually the very first one of the day, so you kind of expect to be one of the first ones in rather than wait for, another hour and a half. So is it by first come, first serve?
It is by appointment time, and I do apologize for your wait. Sometimes if a provider may have been sick or something unusual may have happened in the clinic may have been running a bit late that day. So I do apologize for your situation.
Yeah, and this is Dr. Marsh. I'm the Chief of Staff here. So sometimes it depends on the clinic, but there could be times where there is a provider that gets called away on an emergency. So we do have an inpatient hospital, clinics or patients there, and they could have been called away. That should have been communicated to you, though. So I, again, share Rochelle's apology to you that should not have happened, or it should have been communicated. Well,
it appeared that there was a number of people that were being called in before I was, okay? And maybe they all had 7:45 appointments, I don't know. So I understand if they had to start late, but what my problem was that the other people were being called in ahead of me, and I kind of wondered, maybe I have to come early next time and get checked in early.
That's a great question. And so I think what happened that if you're seeing that, you need to go check back in to the front to tell them that maybe they've missed you. That unfortunately sometimes happens. And so make sure that you step up and make sure that they know that you're there. Again, my apologies. That should never happen.
Thank you for that question. Our next question is Jeffrey in Toronto. Hopefully I'm saying that right. Jeffrey in Toronto, go ahead with your question.
Hello, I'm in Tirana, Albania, currently. I used to be in the Upper Peninsula, and I moved my VA system over to Raleigh, and I still get the calls, and I'm afraid to change my phone number because I'm afraid if this number goes to someone else, they could access some of my personal information or perhaps mess with my appointments. So how can I get my number removed from the Iron Mountain or Madison VA system?
Hi, Jeffrey. This is Liana Torres. I am the Chief of the Health Administration Services. Without knowing where you're getting the phone calls, I wouldn't be able to exactly tell you, but what I can advise you to do is to call our eligibility department, and they will go through the demographics and update any information that needs to be updated. If you have pen and paper, I can give you that number now.
No, that's okay. I'm just curious if something could be done at a higher end because I've spent probably 6 months of my life on the phone with the VA, and I'm about done giving any more time. So that answers my question. Thank you.
Jeffrey, also, if you want to, at the end of the call, we don't want you obviously to announce your phone number to everybody, but you'll have an opportunity to leave a voicemail with more detailed information, and we could look into that. And
I don't mind announcing my number to the veterans. It doesn't bother me. I'm just concerned if someone else gets my phone number that wasn't a veteran. So I'll give you my phone number, and if you could take care of it, that'd be great. It's area code 906.
All right, sorry, I'm gonna I had to mute you there. Just for privacy reasons, there's 1,000 people on the call. I don't want you to get 1,000 texts or phone calls, but you'll have an opportunity to leave a voicemail. And I have to say, I'm also a little jealous you're in North Carolina because I used to live there. And go Tar Heels. Our next question is Neil in Madison. Neil in Madison. Neil, go ahead with your question.
Yes, I was at the VA on Tuesday for my podiatry specialist to see him, and on the way down from the elevator, I came through the hallway by the auditorium and was looking for my pictures of President Trump and the new VA secretary's picture, and I didn't see any on the wall yet. They're just the hooks are on the wall. I wondered if there was something that you guys had no control of, or if it was automatically done, or how it was done.
Sure, fair question. Those photos are ordered actually even before the induction. And I will tell you, this is Jim, by the way, from Public Affairs. I'm on a national distribution list of other public affairs chiefs, and we are all asking the same question as to when we are going to get them. It does take a while, and we are obviously on other people's schedules, but the order for the photos have been placed, and as soon as those photos are taken, printed, and sent to all federal buildings, then it will be updated immediately. It does take some time anytime that there's a turnover, though.
Okay, I understand that. I was just curious because it's almost 2 months since he's been sworn into office, and I was wondering if there was a reason it wasn't being done or if there was not a reason. So that's fine. I understand what you're saying. I'm happy with that.
Sure, and if you want to make phone calls to help speed that process up, I gladly support that.
Okay, yeah, thank you.
And it has taken, it's taken more than a few months before to get some of those photos updated, so it does take some time. All right, our next question, we're going to Roy in Sun Prairie. Roy in Sun Prairie, go ahead with your question.
Yes, my question is, why is it allowed that the pharmacy changes 90% of your prescriptions that the doctor prescribes for you to something different, and then they say that it's the same? Well, sir, there's no way it's the same unless it reads exactly the same. And I just got a letter from him I had my thyroid taken out 3 years or so ago, and Dr. Flynn is my doctor, and February 13th he took tests for results, and the results were in the normal level. And he says, continuing taking the same dosage of the medicine that you're taking right now. Okay? I got a new bottle of it yesterday, and it does not say Synthroid on it. I mean, this has happened numerous times, and I don't care. The pharmacy will tell you they're a doctor. Well, they're not a doctor that prescribes the medicine. They're the person that is supposed to follow the instructions of the doctor that is prescribing the medicine and send that medicine out to the patient, not change it, and not tell the doctor. And this happens all the time, sir. And one other thing I'll say, the gentleman that was talking about, he waited an hour and a half after he was there at his scheduled time, and somebody said, well, they run behind. Well, you know what? They have never once come and said, you know what, we're understaffed, people didn't show up, or they had to go somewhere else. Why is it so hard to let those patients know, okay, we're going to be running behind because this doctor had to go for emergency or whatever? Now, to me, that's the truthful thing to say. But when you sit there for an hour and a half to 2.5 to 3 hours after your scheduled appointment, and nobody says a word to you like you're a bump on a log, that ain't right. Why is it so hard to explain that to the patients? And you never have any hard feelings. Okay, I get it. Somebody got sick, they couldn't come in. You got to get somebody else. They got an emergency, they got to go to that. But if you explain it to the patients, sir, and you would think that these doctors that's got all this great knowledge and schools would have brains enough, common sense, to let people know that. But they have never done it. And they've done that. That's happened to me many, many times. And when you go to talk to somebody that's in the administration, they don't want to even listen to you. Well, you know, that's, you laid your life on the line for the freedom of all these people, but yet the people that are supposed to be taking care of you don't even acknowledge that it ain't no big deal. You have to sit there and wait all day, or you don't have to, you know?
Hey, thanks, Roy. This is Dr. Marsh. I'm the Chief of Staff here at the VA, and I'm sorry that you're having these experiences. Truly, I am. So a couple of things, I'll deal with both of those. For the pharmacy, so, there are laws about this, that the pharmacist can't just change a prescription that a physician or a licensed independent practitioner write. So there are nuances to this, though. So, for instance, there are generic forms of medications that they are allowed to switch to if a physician checks a certain box. And there also are pharmacists who do adjust medications at the discretion of the physician. So I'm not sure exactly what's going on in your particular situation, but for instance, Synthroid is the brand name, and levothyroxine is the generic name. So it's possible that was switched to the generic. Physicians can also specifically request the trade name, the brand name one, so that is something you can talk to your doctors about. And again, about the weight, again, it shouldn't happen, and I'm sorry that's an experience that you've had. People should be communicating, and we will try and do a better job with letting these services know that if we are behind, we need to communicate that.
Thank you for that question and your concern. Our next question is going to be from Scott in Big Flats. Scott in Big Flats, go ahead with your question.
Hi. My question is about dental. That anybody that served 1, 2, 3, 4 years in service, or even more, that we are not allowed to have dental because we are not disabled. I don't know and understand that why. We all put ourselves on the line to go anywhere in the world to fight. And I can't understand that.
Hi, Scott. This is Liana. I am the Chief of the Health Administration Services. I understand your frustration, and I am very sorry about that. Unfortunately, the eligibility for dental services is a very strict one, and it's for highly service-connected veterans only, or for veterans that are service-connected for dental reasons. However, we do have information about some affordable dental services and some affordable dental premiums that are available for veterans. So if you have pen and paper, I can give you the phone number for the eligibility department, and then they have that information available for you, and you can call them and they can go through that with you.
Yes. What's the phone number?
Yeah, it is 608-256.
256.
256.
You said 256?
Yes. 1901. Let me repeat that for you. It is 608-256-1901. And the extension for eligibility is 17038. Again, the extension
17036?
17038.
Oh, 8.
Yep.
Okay, because I was told that I went to the Toma VA. They said, that VA does dental work for veterans. So they gave me a piece of paper, and then I find out that it's through dental care. That I have to pay like $45 a month. And they can't do any dental work or pull teeth or whatever for a year. That doesn't seem right.
The different insurance premiums have different services and different wait time periods. So that's why we could provide you with different options to see what fits for you. That's why I would advise you to call that number. That's a phone line that doesn't have a voicemail or anything, so people will be available to answer the phone when you call. Okay? Thank you.
Thanks, Scott. Our next question, we're going to Chris in Watertown. Chris in Watertown, go ahead with your question.
Good morning. Thank you for this opportunity. So I was curious, do we have any programs that would allow veterans access to fitness facilities? If we're lucky enough to live near a military base, we can quite often use those facilities, but if we don't, there's nothing available. So that's my question.
Hi, this is Sarah Rogers with the Whole Health Program, and I'm going to give you a short answer and a long answer. The short answer is no, we don't have any relationships with gyms in the community that would allow us to pay for a gym membership. The longer answer is for veterans who want to have more exercise and movement. We do have a lot of options, including many online. So, for example, we have yoga classes throughout the week, Tai Chi as well. We already talked about GeroFit for veterans who are 55 plus. And many of these are offered on a virtual platform, so a live class, but you can access it in your own home. And the VA will provide a tablet with an internet connection for any veteran who doesn't have a device or an internet but wants to engage with that kind of appointment or class. Additionally, we have a contract with a provider called Millennium Health and Fitness, and they provide a wide variety of workout classes and programs that are both live throughout the day and pre-recorded. And then the other thing that I'll add is many veterans that I work with in health coaching have found that if they speak to their local YMCA, there are often discounts that are available to veterans and families of veterans. Once again, this is not something the VA funds or a VA program, but the YMCA, many of them seem to have made this commitment to veteran wellness. So if you're interested in any of those programs, it's the exact same number you call to get connected with health coaching. If you're interested in Tai Chi or yoga or learning about millennial health and fitness, 608-256-1901, extension 12537, 608-256-1901, extension 12537.
Thanks, Sarah. Does that also include, can I get more information about the GeroFit program at that phone number?
Yeah, we can get you resources. If you're interested and want to sign up, it's your primary care team that starts that ball rolling for you, so that might actually be the most efficient call or message in My Healthy Vet.
Right. But where can I get a description of what GeroFit offers me before I decide that I want to sign up?
If you want to leave a voicemail at the end of the call, I will have Ryan DeRose, who helps coordinate the program, send you out a brochure.
Perfect. Thank you so much.
Okay.
Thanks, Chris. Our next question is from Jason in Janesville. Jason in Janesville, go ahead with your question.
Yeah, I was wondering about the Annie app. Well, is it coming to replace the My Healthy Vet? Do we have to worry about that? Because I'm kind of worried about the security issues pertaining to possibility that My Healthy or Annie might contain.
Sure, that's fair. This is Jim from Public Affairs. Our expert with the Annie app unfortunately had something come up and couldn't attend. But I do know that it absolutely will not replace My Healthy Vet. My Healthy Vet is something very different and specific and involves your medical records, where the Annie app is something that you self-subscribe to for the automated alerts that you get based on certain topics that you sign up for. So no, there is no concern. That has something that is very different than My Healthy Vet.
Okay, thank you.
Sure. Okay, let's see here. We're going to go to Ricky in Boston. Ricky in Boston, go ahead with your question.
Yeah, I went to Desert Storm and we weren't trained in 100-degree heat before we went over there, and every day we're over in Saudi Arabia, it was over 100 degrees, and we were there for 8 months. They wonder why there's a Gulf War syndrome. Well, you go heat for 8 months, that heat drains your body. I've been tired ever since I got home from Desert Storm. That's been 35 years ago. Oh, it's not right. You got to do something for these veterans. There's other guys in my unit that are having trouble being tired all the time too.
Hi, Ricky. This is Dr. Marsh. I'm the Chief of Staff here at the Madison VA. So I'm really sorry you're having trouble with that. I also want to thank you for your service. So this is definitely a topic that's being looked at very closely by the VA. I'd first of all encourage you to talk to your primary care provider. Being tired can be a symptom of a lot of different things, and so having a full evaluation by your primary provider, I think, is really important to see if they can come up with any reasons that you're having that. There's also a mandate for the VA to do research on Gulf War or exposure related health concerns. And I think you heard about a Gulf War study that was coming here in the near future, and that might be something to look at as well. If you haven't done
I participated in that before.
Okay.
Yeah.
The registry exams are also great. Have you done a registry exam yet?
I don't know, but I was diagnosed with diabetes 4 years ago too, but
okay. Yeah.
I can only do things for like 4 or 5 hours a day, and I'm tired. I got to sit down and rest, but I don't know.
So there's a registry exam where they go through all of the possible adverse effects of the exposures that you had, and can possibly come up with some things that maybe you haven't thought about before. So I think you have a lot of avenues to explore that. And again, I just want to thank you for your service.
Thank you, Ricky, for your question. Our next question is Roger in Beloit, I believe. Roger? Go ahead with your question.
Yes, hello there. My question is, I know a lot of veterans, and I asked them about going to the VA, and they said when they filed their application with the VA that they make too much money and they are denied. And I wonder, I thought they passed a law about 10 years ago that it would not, there was no such thing as making too much money to be denied. Can you verify that for me?
Hi, Roger. This is Liana Torres. I am the Chief of the Health Administration Services. Thank you for your question. That is very important to clarify. There is an income limit for VA services, and it goes by county, and that income limit changes every year. It doesn't fluctuate too much, but it does change, and it goes by dependents also, by the number of family members. And but most important, when you're talking about the law that it was passed, recently on March 6th of last year, 2024, the PACT Act, the biggest legislation for veterans, was enacted, and it's very comprehensive, and it covers a lot. So if you want to get the word out, most veterans can actually enjoy the benefits of the VA and get enrollment because of how big this legislation is, and they can actually get enrolled in the VA and get years of health care without having to apply for benefits, meaning that they can get care without that income requirement if they qualify for. So my best advice is to call our eligibility line, and since it varies from person to person, depending on where they serve, it's to get that DD-214. We can obtain that for the veteran as well, and then go through the eligibility requirements. So since it's so dependable on each person, so I wouldn't be able to tell you exactly what it will be. But most important is to get in contact with us, and we will go through it with each person. So do you know how to get in contact with us? Because I can give you the number.
Yes, in church, there's a couple GIs, and they were saying that they are. One says he's in the National Guard, and the other one says he was in the Afghan War, I believe. I am a veteran of the Vietnam War. I was in the Vietnam War era. So when I left Great Lakes, they sent out of a company of 82 sailors, 6 of us went to the East Coast, and the rest of them all went to the West Coast as replacements. And I'm one of the 6 that went to the East Coast. So I've been in the VA for a number of years, and I'm very well satisfied with the VA in Madison. And I thank you for that.
Thank you. Thank you for your question, and thank you for your service. Our next question, we're going to Dennis in Janesville. Dennis in Janesville, sounds like you have a couple questions. Go ahead, Dennis.
Yeah. Yeah, I was, too, and I've been listening to us so long I kind of forgot some of it, but I was asking, number one, when are they going to get more doctors, or are they going to be able to get more doctors? Because you take so long to get an appointment. So if you deal with that first.
Hi, Dennis. This is Rochelle. I'm the chief of the primary care service. So I'm sorry to hear that you're having a long time with the wait. And actually, is it a primary care appointment or a specialty type appointment that you're having a hard time getting an appointment for?
Well, anything up to Madison. I've come to the point I give up on them because I've even had appointments, they cancel them, and then they write me a note that I missed the appointment. That's happened many times.
I see. So I think it would be most helpful if you could leave your information on a voicemail, and then I would be happy to look more specifically into your situation and could help explain maybe some of that situation. Our wait times are quite variable based on location and specialty and things like that, and so I might be able to help explain that a little bit more based on your situation.
Well, basically, it's on anybody you want to go to in Madison. The other question was, why did they change it where we could, like down here in Janesville, I got a great clinic, great people, I mean, unbelievable. But even trying to get a hold of them now have to call through Madison. And that phone system, really, I'm not dealing with it no more. Why did they change that where we could call right to the clinic and get things done? So, but now we have to go through Madison, which is so screwed up. It's just crazy.
Hi, Dennis. This is Abe Rabinowitz. I'm the Associate Director. This is a complaint that we've heard from veterans over the last several years as we implemented the Clinical Contact Center and the Consolidated Scheduling Service. So that was an attempt to try to streamline scheduling for veterans. Yeah, I hear you snickering, and we've heard concerns from veterans about this. This is something that we're continually looking at and working to try to improve. But we really appreciate you saying such nice things about our Janesville staff. I mean, I think that's something that a lot of veterans have been concerned about and want to try to restore direct connections to the clinic. So we'll certainly take that feedback. Thank you.
Thank you, Dennis. Looks like we have time for one more caller. We're going to go to Don in Monroe. Don in Monroe, go ahead with your question.
Yeah. I've been overhauled at the veterans from toe to bottom. Open heart surgery, prostate surgery, new knees, eyes, dental. I mean, I never had such good care. Even to the guys that park the car and clean the toilets. I go to Madison. If you got an appointment, go early. Don't go right at 8 o'clock. Get up there early and check in. And then they sit in the hallway and they complain. Oh, my God, it drives me nuts. But anyway, I've never had such good care. And Freeport, I go to Freeport, that's where my out, and they're just wonderful down there in Freeport. You guys want a deal or something? I just lost my partner of 57 years of cancer 3 times. And I'm not going to name the hospital in Madison that we dealt with, but if you want to have a horror story, I could tell you one. My poor wife sat in the emergency room for 2.5 hours, and it was called ahead that we were coming. And she broke down. I'll tell you, I could write a book about it. I'm still hostile, but, oh, the VA, I love you guys. You're number one on my list, boys and girls. Thank you.
Don, thank you so much for your kind words, for your service. We're sorry for your loss. We appreciate the support, and that is one thing, you know, we always say our trust scores are traditionally around 94, 95%. And while we are happy with that, we are still striving at that 5 to 6% that we haven't won over. And but we will never stop serving you all. We appreciate your service. We appreciate your questions this afternoon. If we didn't get to your question, please stay on the line. You'll have an opportunity to leave a voicemail, questions, comments, or feedback. We will get back to you. It may take a week, maybe sometimes up to 2 weeks, but we will contact you. We very much, again, thank you for your service, and thank you for joining us today.